If you had hip replacement surgery within the past 14 days and you're still struggling with a lot of pain, then this video is for you. I'm Matt Sigua, a doctor of physical therapy, and in this video, I'm going to share 3 tips to incorporate to reduce hip pain immediately after having hip surgery. Tip number 1, listen to your body when it comes to exercise and walking. So whenever I give exercises for patients after hip surgery, or even when patients are sent home with some kind of home exercise program or packet from their surgeon, all the exercises will typically have a certain number for the reps, for the sets. They'll say like do 2 to 3 sets of 10 reps for this exercise, and a lot of patients will feel the urge to follow that to the T. However, this is not what you want to do. Those numbers are all recommendations. They're essentially guidelines. So if you can hit those numbers without increasing your pain significantly, then great, you can do that. However, that often will cause increased pain if you're just not ready for it. So every body is going to respond differently, right? So what I want you to do is, let's say if you're trying to work on that straight leg raise where you're lifting up your leg and the number you're trying to hit may be 10, but let's say you get to number 6 and then your pain is increasing from maybe like a 2 to a 5. Okay, that's a pretty big jump, and we want to stay underneath that 4 range in terms of pain. So when you hit that, 4 out of 10 pain as you're performing the exercise, stop at that number. So if you hit 6 repetitions and you have more pain, stop at 6, take a break. That break, you can either start off with like a minute, letting that muscle rest, and then you can finish off the set, right? Instead, a lot of people would tend to just push through that increasing pain just to finish out the set. However, once you do that, now you just cause a little bit more irritation and inflammation to those structures, to your quad, and with those tissues, they're already inflamed, they're still trying to heal. And yes, we do want to turn on those muscles, but we have to turn them on as tolerated. So they're going to let you know, your muscles, your tissues, they're going to tell you if they can handle these exercises or not. So with a lot of these exercises, you can expect to have a certain level of pain, but typically you want to stay at a lower range, 2, 3, maybe 4 out of 10 in terms of that subjective pain scale. But if you're performing these exercises and your pain is going up and up and up as you're doing them, that's your sign from your body telling you that it's too much. So listen to your body and then stop once the pain is exceeding, and then return to the exercise either in a few minutes or maybe even later that day. Don't feel the need to do 2 to 3 sets and you're just pushing through the pain. So listen to your body with the exercises. Now, that also applies to your walking. So in general, you do want to be performing daily walking, which you're already doing because you have to go to the bathroom, right? Or to the bedside commode. So you're getting on your feet and you're walking. Now, usually you're going to be increasing your walking amount or distance pretty much every day, right? And it's not a lot, but just maybe like room to room, you're increasing it. So let's say if you're walking and then you're practicing different percentages of your weight in terms of how much weight you're putting on that surgical side, because your precaution is typically weight bearing as tolerated. So usually that's precaution surgeons will give. So that means you can put as much weight as you can tolerate it. Now, let's say you're practicing the walking and the first few feet, you feel pretty good. Pain is very minimal. But then as you increase, maybe you go to like 20 feet or to the next room, and now you're starting to feel, okay, now this is like a 6 out of 10 for my pain. Start to use the walker in terms of how much you're using your upper body and your opposite leg for weight bearing. And what you can do to modify the walking is you can lift up your heel and just use like our step with like your toes on your surgical leg, right? So it's almost like you're tiptoeing on that surgical side just to take some of the weight off of it if you notice that your pain is increasing. Now, as you as you progress, the tissues heal, the inflammation decreases. Obviously, you can increase the weight when you're walking, but let's just say the past 2 days you've been dealing with a lot more pain while you're walking. That just means you need to rely a little bit more on your upper body and on your opposite leg just to take some of the load off of the hip joint to allow it to heal for a couple more days. and then you can start to progress how much weight you're putting into that surgical side, okay? So listen to your body with exercise and with your walking. You want to modify those appropriately, and that should decrease the pain pretty much like the next day because you're adjusting the stresses to those tissues, right? So that's the first tip. Tip number 2, so abiding by the hip precautions, right? So regardless if you had anterior approach, posterior lateral, you have different hip precautions that your surgeon gave you, or they either told you or they wrote it down saying, don't do this movement, don't do this movement, right? Now, with those precautions, not only are they going to help prevent any possible like dislocations of that artificial joint, especially immediately after surgery, it's going to reduce that risk, but they're also there to allow those tissues to heal. Because then if you're going into extreme ranges of motion for your hip, then you're putting a lot of stretch or compression on that new joint and on the tissues, which it's not ready for. So making sure you're abiding by those precautions. Now, where people mess up is, okay, I'm not, if they're, one of the precautions is often don't bend your hip past 90 degrees. So a lot of people would typically be good with, okay, I'm not going to raise up my leg to where it's 90 degrees, but then when they stand up, they'll bend forward and now they just broke that 90 degrees, right? So just being able to recognize those precautions in different scenarios with your day-to-day. So the most common way that it's broken is when people try to stand up, right? So typically if you're talking about that example, then you'll straighten out the surgical side, you try to keep your chest up, and then you lean forward, standing up, right? So versus if you just keep that knee bent and you try to stand, that's going to keep that hip at bent past 90. So just making sure that you apply those precautions to every movement as you go about your day, okay? So those hip precautions are there to keep pain and inflammation down. So just be aware of that. So that's tip number 2. Tip number 3 is a mistake I see patients make all the time. So whenever I see a patient for the first time or even the second time, I'll always warn them about doing this, but yet it happens time and time again. And then once they make that mistake the first time, it doesn't happen again because they learned their lesson. So this is a mistake I want you to pay attention to, and don't be a victim of this, okay? So when I see a patient for the first time or maybe even the second visit, I'll tell them there is going to be some point within that first 2 weeks where you're going to turn the corner, you're going to feel very good, where your pain and swelling is a lot less, and you're going to make the decision of, I'm about to walk a lot more than I did yesterday, or I'm about to not use my walker and walk the same or even a little more than I did the day before because the pain is so much better. And then they'll follow it by saying, yeah, I felt fine with walking more, I felt fine without the walker. But the next day or the next visit, they'll tell me, oh yeah, that was a big mistake because now I felt it. And for some people, the extent of the pain or inflammation, it's more. Some people it's a little bit less, but regardless, they'll all say the same thing where it's like, oh yeah, I overdid it and I felt the difference. I had a little bit more swelling, or I just had more discomfort, whether that was at nighttime or when I walk, I feel it's a little bit more uncomfortable. So once you turn the corner and once you feel like your pain is getting better, that's not a sign that you need to increase your distance of walking by so much. You can increase it, but if you're walking, from one room to the kitchen and back, and that's your typical distance that you're walking at one given time, you can try doing that and then maybe half of that, right? But you don't want to like double it or more than double that distance because your hip muscles, your hip joint, they're just not used to it. So you can build up to that, but that takes a little bit of time, right? Whether that be an extra 2 days, but you don't want to just go from walking 10 feet, it's all of a sudden now you're walking 50 feet, especially without using your walker. So don't try to get rid of your walker too soon just because the pain's getting better, and don't try to walk way more than you did the day before because you have to build up to that. So you will reach that goal, is just don't make the mistake of doing too much too soon, okay? That's tip number 3. And then I did have some just additional tips just in case you aren't doing these things. You should be doing these things. So making sure that you're icing throughout the day, keeping that leg elevated, as well as icing immediately after you exercise or after you try, like doing like a walking bout. Icing that hip is going to keep that inflammation down, keep that swelling down, okay? So throughout the day and especially after exercise. Now, if you are taking any kind of pain medication prescribed by your doctor and you choose to take those, make sure you're right on schedule and you're not missing your timed schedule administration for your medications, right? You want to be as consistent with your medication administration as much as you can, because they definitely will help with a lot of the pain, especially early on, right after surgery, okay? So just make sure you're not being very sporadic or inconsistent with your medications if you are taking medications. Hopefully you found that video helpful. If you did, please subscribe to the channel and I'll see you in the next video.